This is a busy weekend, Shrenik, right? Because today is with you, and tomorrow we have another webinar on metastatic breast cancer.
Wow, lovely. I must admit and rather admire the energy and enthusiasm of ICS team. You guys are,
Absolutely. The lady sitting on my screen to your left is Satinder Kaur, and she
yeah,
looks after the Sahyog group, and she has been instrumental in getting together the metastatic breast cancer a group so that they are addressed by two doctors. I think it is going to be very interesting, and I hope all of you will join up over there.
absolutely. All the very best and wishing this event the next even a huge success. And it's like when there is a will, there is always a way.
Yes, always. I think Satinder, just give the time, please. The link is already on Vaishali's mail.
मैम लिंक डाल दिया गया है और हम सभी से रिक्वेस्ट करते हैं कि कल का वेबिनार भी जरूर अटेंड करें
क्या टाइम क्या है?
4 to 5:30.
4 to 5:30. And we have two doctors there. One
Yes.
is Dr. S.V.S. Dev. He is a very senior surgeon and is currently, I think, in Gangaram, na?
नहीं अपोलो हॉस्पिटल है
Apollo. I thought, okay, maybe I've got it wrong. And the other person, Satinder, is Dr. Jyoti.
यस मैम डॉक्टर ज्योति
Hmm. So it should be a very interesting webinar. There are some survivors of metastatic cancer who are also going to be talking of their experience. So that will be a slight variation in our usual format. It should be good. So I invite everybody, please, to attend that tomorrow.
Tomorrow, 4 p.m. 4 p.m. to 5:30.
Right.
5:30 4 p.m.
Thanks, Vaishali.
Uh, Vaishali, I think we should start now. Good evening, friends. And I'm Shrenik, stage 4 vocal cord cancer survivor, currently in my 28th year. And I'm having a blend of being a patient ambassador and moderator on behalf of Indian Cancer Society, Delhi. And since the month of October is all about breast cancer awareness month, this is our final session pertaining to breast cancer awareness. Today we are having a very competent and someone who has served our nation as a squadron leader, commander, Dr. Anushree Vartak. She is a breast cancer oncologist and specialist across many other verticals pertaining to breast cancer treatment. And she would be sharing all her knowledge, expertise, experience pertaining to breast cancer treatment, protocols, awareness, and everything. So, Dr. Anushree, welcome on board, and the platform is all yours now. Please proceed. Thank you very much for giving your valuable time and we look forward to your enriching conversation. Thank you.
Thank you. Thank you for this kind invitation. Participating in Indian Cancer Society event is like homecoming for me. I've been associated with them as a volunteer oncologist for a long time, and Jyotsna ma'am can, attest to that. And I'm very thrilled to be interviewed by you about a topic which I'm so passionate about. So I've been a listener to all this whole series on breast cancer awareness, and it has become like a knowledge bank for everybody. And now today I'm here to contribute my bit. So I'm going to mostly focus on my talk on what are the recent advances that have come up in breast surgery. And just a couple of days ago, I was talking to a cardiothoracic surgeon. So we began our journey together as general surgery trainees more than a decade ago. And when I gave a talk about the recent advances in breast surgery, he said that, Anushree, I didn't know that so much has changed in last 10 years. So if this is state of our doctors, then we can imagine that we need to make the general public also more aware about what has really changed in breast cancer surgery in last 10 years particularly, and what are these game changers which have led to these advancements. So allow me to share my brief presentation with you, and then I really look forward to my conversation with Shrenik sir. If at any point of time, if you have any questions, please put them in chat box, and I'll request Vaishali, if the presentation gets stuck anywhere, please let me know immediately. So
Uh,
with
Dr. Anushree, I
yes,
mean,
sir.
yeah, now you are visible. Earlier, you were not visible. Now all set, good to go.
Go
Okay, I hope you were able to hear me though.
Yes, ma'am, we were able to hear you. Just camera was not working or something.
Yeah, yeah.
We
Oh,
could hear
okay,
you
Please,
clearly.
okay.
please proceed, please.
So, as I said, let's look at some game changers in breast surgery. So, advanced mammographies have changed the landscape of breast cancer diagnosis and treatment. Are some advanced biopsy techniques which have been game changers in breast cancer treatment, diagnosis, and planning. There are some new techniques like vacuum assisted surgeries, which allow us to do scarless surgeries. I mean, hidden scars are better, but no scars are best. So why not? And this era of breast surgery is all about uh, offering more quality of life for the same quantity. So, for the same amount of survival, we are striving to offer more quality of life, or I would rather say, preserve the quality of life. And fluorescence guided surgery is one such technique which has allowed us to de escalate the extent of our surgery in breast, as well as we all know that axillary or armpit lymph nodes are the next station in breast cancer progression, and they have to be addressed surgically. So these fluorescence guided surgeries have really allowed us to decrease the extent of our surgery in breast as well as in axilla. And then lastly, the biggest changer has been oncoplastic breast surgery. So I'm part of a new generation of breast surgeons who are trained both in oncology as well as plastic surgery techniques, so as we not only remove the cancer, but we reshape the breast in such a way that there is no sense of loss for the woman. So let's dive into each of these. So what has really changed in mammographies? So 3D mammography is a new technique which has now become standard of care in screening mammography. So American guidelines say that wherever it's possible, try to do a 3D mammography for the patient. And why? Because it detects more number of cancers. And how is this relevant to us in India? So in India, our हमारा जो एवरेज एज है ब्रेस्ट कैंसर डायग्नोसिस का, इट इज अ डिकेड अर्लियर, 50. And in 50, almost 50% of women have dense breasts, and which leads to missed cancers on mammography. So for India, all the more relevance of 3D mammography, where we can pick up extra cancers at an early stage, where the survival is maximum. So let me give you an example. So a couple of days ago, my colleague sent this report to me. If you can look on the left side, that Anushree, इस केस के बारे में तुम्हारा क्या ओपिनियन है? व्हाट डू यू थिंक? मैंने कहा कि मैमोग्राफी बड़ी खराब है, ब्रेस्ट की खराबी दिख ही नहीं रही है. सो जो लेफ्ट में आपको मैमोग्राफी दिख रही है, दैट इज एन ओल्ड मैमोग्राफी टेक्निक. Nowadays, if you look on the right side, we do digital mammographies, and that is bare minimum. And now we have gone beyond digital mammography, where we do, to your extreme right, you can see that we do 3D mammography, or it is like a CT scan of breast, where we scan the complete breast in an arc, so that जो डेंस ब्रेस्ट के वजह से जो ओवरलैप होता है बिटवीन कैंसर एंड द नॉर्मल टिश्यू, वो पूरा हट जाता है, एंड द रेडियोलॉजिस्ट इज एबल टू कैच दैट कैंसर अर्ली. Another game changer in mammography is contrast enhanced mammography. So again, a very simple technique, जो हम CT scan में डाई देते हैं, वैसा ही similar डाई देके हम contrast mammography करते हैं. But it is for all of you to see, isn't it? That a conventional mammogram, where the cancer is shadowed by the breast tissue, but on contrast, it is so clear. And if you look closely on the right side at the contrast picture, you see another focus of cancer. So this is where the advantage of contrast mammo is. हमें पता है कि जो मैमोग्राफी पे भी जो एक कैंसर दिखता है, ओनली 40% cancers are truly one focus. Rest 60% of them have multiple microscopic foci in scattered throughout the breast, जो हम कैच नहीं कर पाते हैं. और इसीलिए हम whenever we conserve the breast, हम बचे हुए ब्रेस्ट को रेडिएशन इसीलिए देते हैं, टू टेक केयर ऑफ दिस माइक्रोस्कोपिक फोका. बट इफ वी यूज्ड एन एडवांस्ड मैमोग्राफी टेक्निक लाइक कॉन्ट्रास्ट एनहांस्ड मैमोग्राफी, ये जो फोकाए हैं इनको हम बहुत अच्छे से पकड़ पाते हैं. उससे हमारे जो सर्जरी के आउटकम्स हैं, दे बिकम मच मच बेटर. सो नाउअडेज रूटीनली जो डायग्नोस्टिक मैमोग्राफी होती है, यानी कोई पेशेंट जो सिम्टम्स लेके आपके पास आया, so all the routine diagnostic mammographies are now being done via this technique, so that we catch the all the foci. We are very accurate in mapping the disease, so that we can remove it very accurately with surgery. And it is very, very pleasant and faster compared to an MRI. If we talk about India, it is half the price of that of an MRI. So in a resource constrained setting also, it is quite possible, and it is more accurate than MRI. So false positive findings are less on contrast mammography. So this contrast enhanced mammography has become a real game changer for all of us. And we have done studies on it, and we have seen that it can actually change our surgical decision making. It can alter the extent of surgery. It can change our game plan also. Let's talk about some biopsy techniques as well, which are come up recently. So in the earlier era, हमें सर्जरी करने के बाद ही पता लगता था कि क्या है. There used to be surgical biopsies. And I mean, you can imagine knowing after 15 days that जो lump था वो actually cancer निकला. So अब now we know that कि हमें पहले से ना सिर्फ कैंसर के फैलाव के बारे में पता लगाना है, बट कैंसर के स्वभाव के बारे में पता लगाना है. बिकॉज देर आर सम ब्रेस्ट कैंसर कीमोथेरेपी देना पड़ता है. सो अगर उनमें हम सिर्फ बायोप्सी करने के लिए सर्जरी करें, देन इट इज अ मिस एडवेंचर. सो ऐसे मिस एडवेंचर ना हो, इसके लिए वी डू नॉट एनकरेज सर्जिकल बायोप्सीज एनीमोर. ऑल आर बायोप्सीज in 2024 we aim to do it non-invasively via these biopsy guns, जहाँ पे हमें कोई सर्जरी ना करना पड़े. इट इज जस्ट अ पंक्चर. एंड इसके लिए अल्ट्रासाउंड गाइडेंस में कोर नीडल बायोप्सीज करना हैज बिकम अ गोल्ड स्टैंडर्ड, and it is available everywhere, or I would say universally. So small video, I hope it is playing, about how we precisely take sample from the center of the tumor. And आप लोग सब जानते हैं कि बायोप्सी से बहुत डरते हैं लोग. बहुत डरते हैं. दे थिंक कि इट विल इट विल कॉज कैंसर, इट विल इंक्रीज कैंसर. बहुत सारे मिथ्स है समाज में. बट आई मीन मैं ऑलमोस्ट 1000 बार रोज ये बात कहती हूँ सबसे कि बायोप्सी इज नेसेसरी. एंड उसमें हमें बहुत सारी चीजें पता लगती हैं, जैसे कैंसर का स्वभाव क्या है, इज इट एग्रेसिव, विल इट मेरिट कीमोथेरेपी, अगर कीमोथेरेपी देना है तो क्या हमें पहले देना चाहिए. पिछला जो लेक्चर उसमें श्रेनिक सर ने हेरिडिटरी ब्रेस्ट कैंसर्स के बारे में भी डॉक्टर्स से बातचीत की थी. सो एक ये बायोप्सी में जो स्वभाव आता है कैंसर का, उसमें हमें ये भी क्लू मिलता है कि कैन दिस बी अ हेरिडिटरी कैंसर, सो दैट हम उस पेशेंट का जेनेटिक टेस्टिंग करके वी कैन इंश्योर कि जो आज की तारीख में आपने मेडिकल एडवांसमेंट्स के बारे में भी इस सीरीज में बात की है, तो जो ये लेटेस्ट दवाइयां हैं उसमें से कुछ स्पेसिफिकली हेरिडिटरी ब्रेस्ट कैंसर्स के लिए है, क्या हम अपने पेशेंट को उन दवाइयों का फायदा दिला सकते हैं फॉर बेटर आउटकम्स. सो ये सारी बहुत इंपॉर्टेंट बातें हमें बायोप्सी से पता लगती हैं, एंड इट इज कंपल्सरी. एंड लोगों को एक बड़ा वो टेंशन रहता है कि इसके लिए, इसके रिजल्ट के लिए हमें 1 हफ्ता रुकना पड़ेगा. सो वी ऑल नो दैट कैंसर इज नॉट अ टाइम बॉम्ब, एंड दिस वीक्स वेटिंग टाइम इज कंप्लीटली वर्थ इट, कंप्लीटली वर्थ इट. इससे जो हमारा डिसीजन रिग्रेट है वो बहुत कम हो जाता है. ट्रीटमेंट डिसीजंस के बारे में जो हम रिग्रेट करते हैं बहुत कम हो जाता है. एंड पहले जमाने में जो लीजन्स को हम पाल्पेट यानी जो फील नहीं कर सकते थे ऑन्कोलॉजिस्ट हाथों से, उसके लिए भी हमें सर्जरी करना पड़ता था. बट अब हम इमेजिंग यानी मैमोग्राफी, अल्ट्रासाउंड, एमआरआई और बायोप्सी टेक्निक्स, इनका कॉम्बिनेशन यूज करके ना दिखने वाले स्क्रीनिंग टेस्ट पे जो इंसिडेंटली पता लगे हैं ऐसे भी लीजन्स को टारगेट कर सकते हैं. सो स्टीरियोटैक्टिक बायोप्सी यानी मैमोग्राफी पे कुछ माइक्रो कैल्सिफिकेशन दिखे हैं, प्री कैंसर जिसमें दिखा है. आप सबने ट्विटर पे कुछ दिनों पहले पढ़ा होगा कि एआई ने एक किसी का सीरियल जो मैमोग्राफीज थे 10 साल के, उसमें किसी कैंसर को 5 साल पहले देखा था जब वहां पे सिर्फ कैल्सिफिकेशंस थे. सो आई एम टॉकिंग अबाउट प्री कैंसर DCIS. तो ऐसी चीजों को हम बहुत प्रिसाइजली बायोप्सी कर सकते हैं विद स्टीरियोटैक्टिक बायोप्सी, विद वैक्यूम असिस्टेड बायोप्सी. थर्ड गेम चेंजर है स्कारलेस सर्जरीज. और रादर देन सर्जरी आई वुड से कि डॉक्टर का जो आज की तारीख में एस्थेटिक माइंडसेट है, मतलब मेरे मेरे गुरुजी कहते थे जिन्होंने मुझे सर्जरी पढ़ाया है कि एवरीथिंग दैट यू डू इन सर्जरी शुड हैव अ पर्पस. सो एवरी स्कार ऑल्सो शुड हैव अ पर्पस. वी डोंट वांट टू गिव विमेन अननेसेसरी स्कार्स. सो जहां हम कोशिश कर सकते हैं कि हम वी क्योर द पेशेंट, वी रिमूव द ट्यूमर, बट वी डोंट हैव टू गिव हर अ बैड स्कार. सो वहां हमें सर्जन्स को कोशिश करना चाहिए टू कीप अ एस्थेटिक माइंडसेट, do no harm. So just giving an example, I've tried to not to disturb aesthetics of the presentation, but you can see a scar on the right side, upper side, and believe me, she's a 29-year-old woman, and this scar was given for a infection, for a breast infection called mastitis, which can be cured by antibiotics. So we still in a I mean, if you ask me, this is criminal. Something which can be treated via antibiotics has been treated via surgery. So again, my teachers used to tell me कि the best surgeon is जिसको पता हो कि सर्जरी कब नहीं करनी है. So while we are talking about all these advancements, in breast cancer surgery, I think what we are essentially celebrating is de-escalation of surgery. We have become wiser. We are not putting knowledge before wisdom. So, to a person with hammer, there are nails everywhere. We don't want to be surgeons like this. सो एस्थेटिक माइंडसेट में आजकल हम लोग हिडन स्कार सर्जरीज करते हैं. वी रिमूव जायंट ट्यूमर्स. If you look on the left hand side, it's a giant tumor of almost 7-8 centimeters. But that doesn't mean that we have to give a bad scar or even a visible scar to the woman. So that's what the contemporary breast cancer surgeons are aspiring for. And I think the people should know that so that they can demand that from their surgeons. And then there are some women who don't want any scars for any reason. And with the help of vacuum assisted surgeries, we are able to do that for them. So it's just a puncture wound and we insert the gun and we are able to vacuum the entire thing. No scar. The puncture wound heals within a day or two. So just an illustration to show how vacuum works. Fourth game changer is fluorescence guided surgery, as I mentioned, and I have put these two images on the right just to illustrate that medicine or surgery is a constantly evolving field. So I got this inspiration from a colleague in a recent conference in Istanbul. So he was telling me about this job called knocker upper. So apparently there were people who were employed to wake other people before the industrialization happened in the world, and such jobs have now become absolute. And the only constant is change. So surgical field also keeps evolving and we constantly have to keep our eyes on the horizon. So in breast cancer surgery, there is no room for heroism or no room for aggression, because we know that if we are aggressive, then our patients pay the price for it. So you can see on the right hand side that an aggressive axillary surgery has led to this lifelong morbidity of lymphedema. It's quite apparent for everyone to see. So, such surgical aggression is no longer warranted, because axillary surgery is only meant for us to gauge the disease and not for cure of the disease. So nowadays we are doing fluorescence guided axillary surgery so that we are able to, cause less damage. Less is more. So we are only looking at removing the required number of lymph nodes and preserving the lymphatics or the lymph vessels of the arm. And anybody who has volunteered in a cancer society is familiar how morbid lymphedema can be. Our volunteers can agree to this. So मतलब रोग से इलाज भयंकर नहीं हो सकता, and we really need to uphold that. So axillary staging nowadays we do with such dyes, fluorescence dyes, blue dyes. And we also map the lymphatics beforehand so that when we are doing the surgery, we are not damaging them. And for some reason, if we have to do a very aggressive surgery, then we also do a preventive bypass, a lymphovenous bypass via super microsurgery, so that we can still prevent the lymphedema. So here, sorry for the surgical picture, but just to illustrate that we have done more here, but the woman has not got lymphedema. So she's underwent a preventive lymphovenous bypass, and we have saved her from lymphedema. Last game changer is oncoplastic breast surgery. And I actually want to say that not just surgeons, but an oncoplastic breast surgery team is essential, because breast cancer is a treatment, is a complete team sport. No one person can be, no matter how heroic the oncologist is, but we need a good team for the best results. So, oncoplastic breast surgery is a paradigm shift in the field of breast cancer treatment, something similar to what AI is doing to the world. And it has evolved from these basic changes that have happened in breast cancer treatment. So now everywhere there is rise of organ-based oncology teams. uh, it's because we are pursuing excellence, and also because we are in a litigious society where there is no power dynamic between patients and doctors, and that's a good thing, believe me. Now we have realized that breast conservation is a superior treatment in combination with radiation. So breast conservation surgery plus radiation is a superior treatment to mastectomy, especially in early breast cancer, and it is equal to breast removal, even if the cancer is advanced. So this is a complete shift from last decade, and surgery alone cannot cure breast cancer. So हम इसको बिल्कुल क्रिकेट के जैसे खेलते हैं. So surgeons are opening बैट्समैन एंड देन कीमो वालों को हम बुलाते हैं, एंड देन टेल एंडर्स जो हैं वो हमारे रेडिएशन ऑन्कोलॉजिस्ट है. सो मैं हमेशा कहती हूँ कि ओपनिंग बैट्समैन की सेंचुरी होने से मैच नहीं जीता जाता, सबको 50 ओवर खेलने पड़ते हैं, तभी हम लोग जीतेंगे. And breast cancer genetics has come up in a big way. We are realizing more and more role of genetics. And as I said, we are not only focused on cure, but we are also focused on cosmesis and quality of life. So we have done away with these kind of traditional breast surgeries जहाँ पे बड़े बड़े सीरोमा होते थे मैस्टेक्टोमी के बाद. ब्रेस्ट कंजर्वेशन के बाद में भी इतना खराब कॉस्मेसिस होता था कि पीपल यूज्ड टू थिंक कि इससे अच्छा मैं ब्रेस्ट रिमूव ही करा लेती. सो दीज काइंड ऑफ सर्जरीज आर नॉट डन एनीमोर. So all breast surgeons have become oncoplastic breast surgeons. So there we are using these plastic surgery techniques to reshape the breasts immediately after removing the tumor. So this is the current standard. So if I had not put these pink circles, you would not have realized कि surgery कहाँ से हुआ है. And the axillary surgery is only visible to you because of our dye, the ICG dye, which is giving it a green hue. And we have so many new techniques like these chest wall perforator flaps, for example, where a woman has so much of fat or tissue lying around. We have love handles on the side of the breast, in the upper part of our abdomen. So we are easily able to use this naturally occurring her own tissue to reshape the breast, and that has completely changed. You can see the outcome. So this woman unfortunately had undergone a surgical biopsy, unfortunately, and has had left the biopsy led to a very bad scar. But we have done a revision surgery, and we have not only completed the removal of the breast cancer, but we have actually improved the results of her surgery, and we've given a good cosmesis. Similar, this is another revision surgery where somebody had removed the tumor thinking that it is just a benign tumor, and we completed the surgery, and again another perforator flap has been used, and you can see that this goes beyond cure. We also use ICG to guide, to check whether all these advanced flaps are well vascularized so that there are no complications after the surgery. We know on the table whether our techniques are working, and this leads to improved results and less distress for the patient also. And sometimes we are able to cure also and lift also. So techniques like therapeutic mammoplasty, again borrowed from plastic surgery, where we leave better looking breasts after cancer removal. Similarly, for people who have genetic mutations, we are able to do conservative mastectomies where we only remove the nipple or the excess skin, and we are able to do complete reconstruction for them so that their external, the form of the breast appearing externally is not at all disturbed. We fill them with flaps or silicone implants. So this is an interesting case. This woman had a 1.8 kg tumor. She had not she just she was so anxious about getting diagnosed that she did not report to us for 4 years. But God is great. God is great. Whenever I see these patients, वो बहुत गिल्टी होते हैं कि मुझे माफ कर दो मैं इतना लेट आई. मैंने कहा आप अकेले नहीं हो. We all go through this anxiety of कि मैं कुछ डायग्नोज हो जाएगा तो मेरा क्या होगा, मेरी फैमिली का क्या होगा. बट इट्स ओके. आई एम ग्लैड यू केम जब भी आप आए, एंड वी आर स्टिल एबल टू गिव देम डिसेंट रिजल्ट्स. सो वी हैव डन अ कंप्लीट रिकंस्ट्रक्शन फॉर हर. सो आई थिंक ब्रेस्ट सर्जरी में एक्सेलेंस इम्प्लीमेंट करने के लिए वी नीड दीज थ्री थिंग्स. वी नीड विजन, we need infrastructure, and we need team. So डॉक्टर गीता काद्याप्रथ हैं जो ब्रेस्ट सर्जन हैं, शी इज सीनियर टू मी. सो मैम हैड सेड कि ऑथेंटिसिटी इज द ग्रेटेस्ट लग्जरी इन योर प्रोफेशनल लाइफ, एंड आई अग्री विथ हर. कॉम्पिटेंस जो है वो तो इज टेकन फॉर ग्रांटेड, बट जो आपकी ऑथेंटिसिटी है वो दैट इज द थिंग विच कीप्स यू गोइंग एंड ब्रिंग्स यू सो मच हैप्पीनेस. So if you ask me ki, what is your brand, Anushree, yeah, what are you doing in breast surgery? So what I am trying to do is to go beyond competence, and I believe that we need creativity, we need compassion, and we need communication for achieving excellence in breast surgery. And women's health में equality काफी नहीं है. I think we need to bring empathy, we need to be equity, we need to spend those 10 extra minutes in the OT to give her a beautiful scar, which will preserve her confidence. And we need excellence. I always tell my patients ki, demand more things. Don't settle. Don't settle for anything in your treatment. अपने डॉक्टर से मांगो चीजें. So, and of course, infrastructure and a team. I'm very grateful that everybody on my team, be it my radiologist, pathologist, our anesthetist, my radiation oncologist, because surgery is only half part of treatment. You need to have an equally good radiation oncologist for these kind of advanced breast cancer surgeries. And soon, I think with Sir, we'll again talk about robotic breast surgery someday, which is the next game changer in breast cancer surgery. And I just want to, just express my, my gratitude towards Indian Cancer Society. I've seen them for so many years now, and I think they are doing phenomenal work for survivorship support. LIC का लोगो मैंने लगाया बिकॉज इनवॉलेंटरी हमारे दिमाग में बजता है ना, जिंदगी के साथ भी जिंदगी के बाद भी. सो आई थिंक ऑल द people who are involved in doing breast cancer treatment, उनको कैंसर के टाइम पे भी साथ रहना है और कैंसर के बाद में भी पेशेंट्स के साथ रहना है. वी शुड नॉट ब्रेक दैट कनेक्शन आफ्टर ट्रीटमेंट. एंड आई रियली रियली चेरिश बीइंग अ पार्ट ऑफ survivorship support with Indian Cancer Society also. And just just last 2 seconds, sir, if you allow me. So I just want to thank you, sir. So I just want to share my journey with you. My how I became an oncoplastic surgeon. So I found myself what I wanted to do. Then I found my mentors once I realized कि मुझे क्या चीज़ सीखनी थी. And I went to Dr. Koppikar in Pune and Professor Altomir in Rome to learn about oncoplastic breast surgery. Then I found my team. I found my tribe, which includes Indian Cancer Society also. They helped me do so much of volunteer work for cancer patients. And then I found my life purpose. So thank you so much.
Dr. Anushree, your entire game changer talk can be described in one sentence, which is coordinated with your name. That is, Anushree is equal to authenticity. I must admire your previous career in a Navy discipline, and laser focus mindset. I am using laser focus mindset because in radiotherapy, the way in which treatment is given in the same manner the surgical procedure is being done. And I must say that you're very categorically mentioned about having a wisdom. I mean, it's not about performing surgery, it's all about having a wisdom while performing surgery so that patient can have a scar surgery, a better life outcome and whatnot. And I must say that the presentation slide says speaking is one thing, but presenting slides and giving you explanation with everything, that was, I must say, it was much more than remarkable. Thank you so very much. We loved the entire session. And yes, I mean, of course, this was, we are still having breast cancer awareness month, 3 more days left over. But your contribution as a breast cancer surgeon and plastic surgeon, you are truly empowering the women community to the core. Thank you so very much, and we are really grateful for having you today. Vaishali, please see if there are any questions, and we go from there.
Great talk, ma'am. Sir, we do not have currently questions in YouTube, and yeah, we don't even have questions in Zoom currently. I think our people would like to ask themselves the questions. So the floor is open for you all to ask questions.
Anushree, we have a few survivors who are in the audience. So
Ma'am.
I'll request them to come in because that is really Satinder, Sangeeta, who
Yes,
else?
ma'am.
Yeah, go ahead.
डॉक्टर अनुश्री की इतनी अच्छी प्रेजेंटेशन थी और इतना स्वीटली आप बोल रहे थे कि हम तो सुन के ही इतने खुश हुए हैं। और सेकेंडली मेरी 2 टाइम सर्जरी हुई है 25 ईयर्स पहले और उसके बाद 12 एंड 13 ईयर्स हो गए। तो मेरा स्कार भी जो है वो काफी बड़ा है। तो मैं बड़े गौर से देख रही थी कि उस टाइम की ट्रीटमेंट में और अभी की ट्रीटमेंट में कितना फर्क है। अगर आप उसे रोबोटिक सर्जरी कहती हैं तो रोबोटिक सर्जरी में तो और भी स्कार कम हो जाता होगा शायद। हम लोग अपनी बॉडी को जब देखते हैं और जो आजकल के टाइम में जो सर्जरीज हो रही हैं उसमें बहुत फर्क है। उस टाइम में और कीमो में भी बहुत फर्क है। तो ये जो हमारी साइंस ने या हमारे डॉक्टर्स ने जो इतनी आगे आए हैं, इतनी तरक्की करी है, उसके लिए तो हैट्स ऑफ ही है कि इतना ज्यादा इस टाइम में और लोग बहुत अच्छे से इसको कवर कर पा रहे हैं। इसको इतना जबरदस्त आगे जाकर इनका हो रहा है कि भाई अभी ब्रेस्ट कैंसर एक जो खौफ था वो खत्म हो रहा है लोगों में। लोग बोल रहे हैं, खुलकर बोल रहे हैं। पहले लोग बताते भी नहीं थे कि हाँ हमें कोई इस तरीके की बीमारी है। तो रियली आप बहुत ही ज्यादा आप लोगों ने किया है और उसके लिए हैट्स ऑफ है आप लोगों को।
Thank you,
थैंक
ma'am.
यू मैम, थैंक यू।
Thank you so much. I'm Sangeeta. Thank you so much, Dr. Anushree. The talk was very good, and you told us so much about the new techniques, which even I didn't know about. So, so it's easier to talk to a patient, a person who's just discovered a lump or something, so you just tell them that things have come easier now, better now. So what you've told us is also going to help us with our work. And thank you so much for that. I was detected with cancer 15 years back. So I have a very big scar. I had cobalt. My radiation was cobalt. So my whole breast was quite, it got sore and there was sores on it. And, so I'm so happy now that there are new techniques and things have become much better for the patients. And thank you so much for all the work that you're doing. Thank you so much.
Absolutely, ma'am. And I think, I mean, to all of you survivors, I would like to say that we also, I mean, if at any point of time you just want to, we can always improve upon what has been done. So I always tell my patients that ऐसा ऐसा कुछ भी नहीं है. I'll give you an example. So मेरे मेरे एक family member हैं, and she had this surgery like a decade ago. And when तब तो मैं पढ़ाई कर रही थी. And then after, I mean, recently, she told me कि Anushree, this fat bulge on the other side really bothers me. तो मैंने कहा, आंटी, हैव यू ट्राइड दिस पिलो? सो आई सजेस्टेड like a U-shaped pillow to her. And then after a few days, she called me saying that, oh, this simple thing has made my life so easier. So I can totally understand, ma'am, that I'm sure 10 years के बाद the younger surgeons will say कि अनुश्री मैडम तो क्या पुराने सर्जरीज करती थी, अब तो हमने तो now we are using nano robots. But I think, ma'am, if at any point of time, if ever you feel like that, even the simplest things can make such big differences.
Yes.
You just have to imagine.
Yes.
मैम ये रोबोट सर्जरी जो मैक्स में भी हो रही है, नहीं हो रही?
सो मैम,
रोबोट
जो रोबोटिक ब्रेस्ट कैंसर सर्जरी है, वो इस टाइम पे ज्यादा यूरोप में और बाकी कंट्रीज में हो रही है. इंडिया में 2-3 सेंटर्स हैं बैंगलोर में, उन्होंने शुरू किया है पहल. द स्कार्स आर द सेम. इट्स मोर अबाउट द प्रिसिजन ऑफ सर्जरी, एंड इट इज मेनली बीइंग डन फॉर पीपल विद जेनेटिक म्यूटेशंस, जिनमें हमें निपल स्पेयरिंग मैस्टेक्टोमीज करने होते हैं. सो उसके लिए टू ब्रिंग मोर, बिकॉज दैट इज अ सर्जरी वेयर वी आर ऑपरेटिंग इन द डार्क यूजुअली, और विद big retractors, and that the mobility of robotic arms and the vision that we get on the robotic platform. So अभी ये एक limited surgical scope है इस चीज का. But then I'm sure in another 10 years
yes,
we'll
yes,
find more applications for it. I think if we are ready to adapt to newer techniques,
yes, yes.
anything which makes life easier, happier for our patients, then it will happen.
Thank you.
Anushree, we have a support group in rehab center called Prashanti, which
Ma'am,
is in Chittaranjan Park. The breast
ma'am,
cancer group meets on Wednesdays. And
ma'am,
I think one Wednesday, perhaps, if you can do a simple talk, not
ma'am,
so much in detail on the surgical skills, as in how to make the best of life after cancer.
ma'am.
Would you be able to do that?
Ma'am, it will be my privilege, ma'am.
That's wonderful. So, Satinder,
Yes,
you
ma'am.
have a program set.
Sure, ma'am. Sure.
Yeah.
मैं
I
मैम से बात
think everybody will.
थोड़ी सी
I think everybody will benefit from that.
Yes,
And lastly, Anushree, I wanted to add 2 more words to your compendium of efficiency and empathy and all that. I think the most important is respect for your patient. A lot of times women don't come because they're afraid more of facing an educated, supercilious person behind a desk. And if you can reach across and take that woman's hand and talk to her as woman to woman, it would make a huge difference.
Absolutely, ma'am. Absolutely.
Yeah.
Well said,
मैम
ma'am.
मोस्टली लोग बायोप्सी और एफएनसी से डरते हैं, तो क्या उसकी टेक्निक में भी कोई फर्क है? मोस्टली लोग ये सोचते हैं कि नहीं, बायोप्सी नहीं कराना है, तो आप इसके बारे में क्या कहती हैं? मतलब जिस भी लेडीज को बोलते हैं ना कि बायोप्सी, तो वो कई बार बैक स्टेप ले जाती है कि नहीं, अभी हम कहीं और दिखाएंगे, अभी बायोप्सी नहीं करवानी। तो क्या हमारे पास कोई और, जैसे अल्ट्रासाउंड है, या उससे हम इसको डायग्नोस कर सकते हैं कि हाँ आप बायोप्सी के बिना अल्ट्रासाउंड से या किसी और टेक्निक से?
मैम,
हालांकि पैट स्कैन से तो करते हैं, लेकिन अल्ट्रासाउंड से मैं थोड़ा सा पूछना चाह रही थी।
मैम, ऐसे तो हम लोग मैमोग्राफी या अल्ट्रासाउंड पे उसका चेहरा
यस
देख
मैम,
के
यस
ही
मैम।
विद एक्सपीरियंस इन मोस्ट केसेस पहचान जाते हैं, लेकिन वी ऑल्सो नीड प्रूफ ऑफ द पुडिंग बिफोर वी पुट पेशेंट्स. to surgery, chemo or radiation. These are drastic treatments. So बहुत कम पेशेंट्स ऐसे होते हैं कि when we explain to them कि biopsy is safe, biopsy is scientific,
Yes.
necessary,
जी
उसके बाद एक 5-10% पेशेंट ऐसे होते हैं कि जो बच जाते हैं. आई ऑलवेज गिव देम दिस एग्जांपल कि आपकी किसी ने डोर बेल बजाई है रात को 12 बजे, एंड आपको ऑप्शन दिया जाए कि आप पीप होल से देखिए या तो आप सीधा दरवाजा खोल दीजिए. व्हाट विल यू प्रिफर? यू वुड लाइक टू इंश्योर योर सेफ्टी,
यस मैम.
पीप होल से देखना पसंद करेंगे, एंड देन यू विल ओपन द डोर. सो इस तरीके से हम बहुत चीजें तरीके से समझाते हैं. एंड देन ओनली 5% विमेन हु आर लाइक सुपर एंग्शियस, सुपर सुपर एंग्शियस, तो
यस.
उनको मैं कहती हूँ कि आई विल नॉट डू अ सर्जिकल बायोप्सी. मतलब सिर्फ बायोप्सी के लिए हम सर्जरी नहीं करेंगे, लेकिन इफ यू आर वेरी एंग्शियस अबाउट बायोप्सी तो हम वी कैन रिमूव द ट्यूमर एंड सेम सिटिंग में आई विल कंप्लीट योर सर्जरी. So, with the help of frozen section, so we do this definitive oncoplastic surgery under frozen section guidance, where we are very sure that it's a cancer, but it's only a matter of proving, and the woman is super anxious. I'm talking of rarest of scenarios. Then I feel that we need to take a middle path. So, once or twice a year, it happens that we need to take the oncopathologist's help and say that, I'm gonna just, give you a tissue, you give me a confirmation, and we're gonna complete the surgery properly in the same sitting. So, but that's an extreme option. That's an extreme option, if you ask me. Majority of the times, and अभी तो मैम एक बहुत अच्छा स्टडी आया है टाटा मेमोरियल का, which has really helped me convince patient. So, उनका स्टडी वर्ल्ड वाइड इसको बहुत पब्लिसिटी मिली थी कि हम लोग जो लोकल एनेस्थीसिया देते हैं ब्रेस्ट कैंसर के अराउंड, वो देने से उसका स्प्रेड लिमिट हो जाता है.
ओके.
सो ये स्टडी कहने के बाद कि जब हम बायोप्सी करेंगे, आपको जब एनेस्थीसिया देंगे, उससे एक दीवार खड़ी हो जाएगी और आपका कैंसर वो दीवार नहीं पार कर पाएगा. सो इट्स ऑल द वे वी एक्सप्लेन, वी
Yeah.
ट्राई.
हेलो अनुश्री मैम, मैं
थैंक यू मैम.
आपसे बात
थैंक यू
करना
सो मच.
चाहती हूँ.
थैंक यू.
हेलो मैम, कैन यू लिसन मी?
Yes.
अनुश्री मैम.
Yes, I can hear you.
हाँ, हेलो मैम, आपका लेक्चर बहुत अच्छा था, मैं बहुत अच्छे से सुन रही थी. मैं भी कैंसर पेशेंट हूँ मैम. मेरा 2.5 year हो गए हैं ब्रेस्ट कैंसर में. मेटास्टैट है, TNBC मेटस्टैट है. तो मेरी सर्जरी तो उन्होंने मना कर दी कि सर्जरी नहीं होगी. वंस जो फर्स्ट मेडिसिन का ईयर था, उसमें मेरा मतलब बिल्कुल खत्म हो गया एक तरीके से. लेकिन कैपेसिटापाइन चलते चलते मुझे रीलैप्स आ गया वहीं पर ही उसके साथ, और एक छोटा सा हो गया. अब क्या हो रहा है मैम, मैं जेम कार्बा ले रही हूँ. जेम कार्बा लेते ही मेरा ब्लड डाउन, HB डाउन, मेरा क्या कहते हैं TLC डाउन, प्लेटलेट्स डाउन, बिल्कुल डाउन हो जाते हैं. मैं बहुत परेशान हूँ. मतलब कोई और मेथड, कोई और टेक्निक, कोई और पॉसिबिलिटी है मेरे केस में, आप बता सकेंगी?
Ma'am, with all due respect to you, but this is not the correct forum to discuss treatment. With all due
ओके.
respect, ma'am. So मैंने
ओके.
अपना ईमेल एड्रेस लिखा है because इस तरीके के conversations हम casually नहीं कर सकते. I need to
ओके.
go. I need to see you. I need to go through your entire file, and
ओके.
उसके बाद ही मैं कुछ कर पाऊंगी. But
लेकिन
I'm
जो
very.
आप बायोप्सी और जो प्रोसीजर्स आप बता रहे हैं, मैं उससे गो थ्रू हो चुकी हूँ. सब
I
चीजें
understand,
2
ma'am.
times. हाँ जी.
I
तो
understand, ma'am, but this talk has to be one-on-one.
ओके.
So
ओके, फाइन.
everyone in ICS has my contact. मैंने chat box में भी मैं अपना email address डाला है,
जी
and
मैम.
I can share my number as well. But this needs to be discussed one-on-one because आपका कैंसर उतना ही यूनिक है जितनी आप यूनिक हो, and उसको बहुत केयरफुली मुझे उसकी पढ़ाई करनी पड़ेगी. फिर ही मैं ऐसे कैजुअली कमेंट नहीं करना चाहती.
नहीं,
मैं ज्योत्सना
थैंक
मैम ने
यू
कहा
सो
कि
मच.
यू हैव टू रिस्पेक्ट द पेशेंट, यू हैव टू रिस्पेक्ट द डिसीज आल्सो.
Yes.
सो yes, so let us have this conversation one on one. Ma'am, can I ask one question? क्या मैं एक क्वेश्चन पूछ सकती हूँ?
जी जी, बिल्कुल श्योर मैम.
So I want to ask Shrenik sir, कि वो इतने सारे डॉक्टर्स से मिलते रहते हैं, उनको इंटरव्यू करते रहते हैं सर.
हाँ जी.
सो व्हाट डू यू थिंक अबाउट द, और मतलब आप खुद इससे गुजरे हैं सर, व्हाट डू यू थिंक अबाउट द पावर डायनामिक बिटवीन डॉक्टर्स एंड पेशेंट्स? मतलब वो जो एक पुराने जमाने में होता था ना कि डॉक्टर यहाँ है एंड पेशेंट यहाँ है, एंड वो कह रहे हैं कि जो आपको ठीक लगे वो करिए. वेराज जो हमारा जनरेशन है वो बिलीव करता है कि वी शुड बी इक्वल, हमें शेयर्ड डिसीजन मेकिंग करना चाहिए. बट ऑल दैट इंफॉर्मेशन ओवरलोड मेक्स पेशेंट्स एंड डॉक्टर्स बोथ मिजरेबल. ऐसे लगता है कि पीएचडी कर रहे हैं दोनों बैठ के. सो कुछ कुछ सर इसमें, वी डोंट नीड नॉलेज, वी नीड विजडम फ्रॉम यू. सो as somebody who's been in this field for a long time, please guide us.
Uh, well, let me tell you. I mean, whoever oncologist I am met, look, I am so much fortunate of having acquaintances with over 500 oncologists all over the world, and they are too humble, too kind, to extend whatever support is required for their patients, not only for caregivers as well. And what I have noticed, I mentioned earlier that their approach is precisely laser focused. I mean, if they can do it, they will tell everything black and white. If they cannot, they will say no. And one of the reason, Dr. Anushree, we are conducting these sessions at ICS Delhi and inviting eminent oncologists like you for simple reason that we do not want people to play shot in dark simply by following web browsers and doing these and other slums. And then we value your expertise, knowledge, years of experiences, and whatnot. And let's not forget, apart from oncologists, including you are indeed a wonderful human being. I mean, humanity, empathy, everything is at core. Everything is at core, and then coupled with your discipline from Navy, from being a lieutenant commander, and so on. So these are like, I mean, that they can be chamgo dinner time. Okay, so this combination is like a subway wedge delight. That means there are all single component to make things really delicious. And let me tell you one more thing. In most of my TEDx talk, particularly in medical colleges and other institutes, I remember to mention that choose oncology by default if you are into medical field, because India need a lot of oncologists and in 2 tier 3 tier cities and even metro cities for providing affordable and quick treatment, as we value the life of the human, and save those who have undergone such dreadful disease treatment and whatnot. Only they know what exactly the dreadful cancer is. But you guys, as an oncologist, you are a real game changer, I must admit that. And that what I mean, for with any oncologist, I am always having a passion to interact as much as possible, because look, I cannot be a doctor in this life, but at least I can try to learn something, and from that learning, I can give some sort of direction, guidance to the cancer patients and caregivers. And I want them to feel that you are not alone. I mean, this is what you said earlier. I want to align your statement with the people that you guys are never alone.
Thank you, sir.
I guess Vaishali, I mean, we had enough time of Dr. Nusri and Dr. Nusri. I mean, we will be having Diwali holidays from next week. You are warmly invited to अहमदाबाद. आप आइए हमारे साथ में गुजरती थाली कभी ट्राई कीजिए, शायद आपको ना वापस गाजा बजाने का मन नहीं लगेगा, ये मैं गारंटी देता हूँ.
Absolutely, sir.
Ma'am and sir, I would like to share one more thing with everyone कि जो हमारी राइज अगेंस्ट कैंसर मोबाइल ऐप है उसमें अनुश्री मैम ने भी काम किया है ऑन मराठी component. She has developed oral cancer.
Thank you.
Very good, very good. Thank you, ma'am. Thank you so much.
Vaishali, I mean, if she has worked in a oral cancer, that means she will have to come to our platform once again. Apart from, breast cancer numbers, I would like to invite her for kidney cancer as well in coming times.
Sure, sir.
Yes,
Thank
sir.
you, sir. It will be a
Definitely.
pleasure.
We will invite ma'am officially, not emergency cases for.
And then, I mean, trust me, Dr. Anushree, Yes, I'm not talking about ICS daily now. I am talking about myself. You have saved my face today. I mean, I got a text from doctor that I'm unable to join today to do some health issue. So thank you for making our day. Thank you so very much.
It's my pleasure, sir. I look at it as a manifestation. I really wanted to converse with you. We have been LinkedIn friends for a long time and really thoroughly enjoyed this conversation today, sir. Thank you so
Thank
much.
you, thank you. We are deeply honored, and thank you very much for on behalf of ICS and our chairperson Josnaji and Vaishali, Priya, everyone from ICS team. Thank you once again.
Thank you.